Ever since she was a little kid, Laura Magennis says she knew she'd be on the front line fighting germs and diseases.
When I was 4, I think I got a little nurse kit as a toy, and ever since then I've wanted to be a nurse.
And in the midst of other various infectious disease outbreaks in the last 30 years, even her family has never questioned her career path.
They just accepted that's what I was doing, and if I came home and went straight to the shower, they knew not to ask questions.
Now, as the world is fighting COVID-19 or the coronavirus, she says life for nurses hasn't really changed.
I think being prepared is the #1 thing.
And while people at home can follow simple steps like washing your hands, covering your cough, and most of all,
I've seen a lot of employers that have encouraged people to stay home rather than to come into work, so I think that is a good thing.
For those who work in the medical field, Magennis and the North Carolina Nurses Association say now is the time to get plans in place.
If there is a potential for any kind of contamination, we change our clothes, we take a bath, whatever we need to do to take care of ourselves and our families. Most hospitals, though, have in place personal protective equipment that would help to protect nurses from even having to worry about that.
And while Magennis says the virus is concerning,
the elderly and the frail tend to be more at risk, which is why it is something to take seriously.
She says the best thing to do is make sure you and your family are ready.
I think there's always concern, and I think we should be aware of it, but I don't think we need to panic. At this point, I think it's using the common sense, stay home if you're sick, and wash your hands as much as you can.
In Mount Holly, Courtney Davis, Spectrum News.